The Ultimate Guide to Permanently Curing PCOS, a step-by-step guide. Polycystic Ovarian Syndrome, PCOS, is a common hormonal disorder among women of reproductive age. If left untreated, PCOS can cause infertility, weight gain, depression, and other serious health complications. Thankfully, there is hope. This Ultimate Guide to Permanently Curing PCOS provides a step-by-step approach to overcoming the disorder and restoring health. From making dietary and lifestyle changes to exploring natural and medical treatments, this guide will equip you with the tools and knowledge you need to take control of your health. You'll learn how to tackle the root causes of PCOS and gain insight into the most effective treatments available. With the right approach, you can banish PCOS from your life and reclaim your well-being. Understanding the causes of PCOS. PCOS is a complex condition that can affect women in different ways. It is thought to be caused by a combination of genetic, environmental, and lifestyle factors. While the exact cause of PCOS is still unknown, researchers have identified several key factors that can contribute to the disorder. First, PCOS is believed to be caused by an imbalance of hormones, specifically a lack of progesterone and an excess of androgens. Androgens are male hormones, and an imbalance can lead to the development of cysts on the ovaries and interfere with the menstrual cycle. Additionally, insulin resistance is thought to be a major factor in PCOS. Insulin resistance is a condition in which the body cannot effectively use the hormone insulin, leading to high levels of glucose in the blood. This can cause the ovaries to produce excess amounts of androgens, further exacerbating the hormonal imbalance. Another potential cause of PCOS is inflammation. Chronic inflammation can interfere with the production of hormones and lead to a number of different health issues. Finally, genetics may play a role in the development of PCOS. Studies have shown that women with a family history of PCOS are more likely to develop the disorder. Dietary and lifestyle changes for PCOS treatment. Making dietary and lifestyle changes is one of the most important steps in treating PCOS. Eating a healthy, balanced diet and getting regular exercise can help to regulate hormones, reduce inflammation, and improve overall health. When it comes to diet, it's important to focus on whole foods that are high in fiber and low in sugar. Foods such as fruits, vegetables, whole grains, and legumes are all excellent sources of nutrients and can help to regulate hormones. It's also important to limit processed foods, which are high in sugar and unhealthy fats. Eating a diet that is rich in healthy fats, such as avocados, nuts, and olive oil, can also help to improve hormone balance. In addition to a healthy diet, getting regular exercise is essential for treating PCOS. Exercise helps to regulate hormones, reduce inflammation, and manage weight. Aim for at least 30 minutes of moderate intensity exercise a day, such as walking, running, or cycling. Strength training is also beneficial, as it helps to build muscle and improve insulin sensitivity. Finally, it's important to get enough sleep. Aim for 7 to 9 hours of sleep per night to ensure your body has time to rest and repair. Natural remedies for PCOS. In addition to dietary and lifestyle changes, there are also several natural remedies that can help to treat PCOS. Herbal supplements, such as chasteberry and saw palmetto, can help to regulate hormones and reduce inflammation. Additionally, omega-3 fatty acids, such as those found in fish oil, can help to reduce the symptoms of PCOS. Vitamin D and magnesium are also essential nutrients for treating PCOS. Vitamin D helps to regulate hormones and reduce inflammation, while magnesium helps to reduce insulin resistance. Finally, acupuncture can be beneficial for treating PCOS. Acupuncture is an ancient Chinese practice that involves the insertion of small needles into the skin. Studies have shown that acupuncture can help to regulate hormones, reduce inflammation, and improve fertility in women with PCOS. Medical treatments for PCOS. In addition to natural remedies, there are also several medical treatments available for PCOS. Hormone replacement therapy is one of the most commonly used treatments, as it can help to regulate hormones and reduce the symptoms of PCOS. Birth control pills can also be used to reduce androgen levels and regulate the menstrual cycle. If diet and lifestyle changes are not enough to improve symptoms, medications such as metformin and spironolactone can be used to reduce insulin resistance and regulate hormone levels. Additionally, medications such as clomiphene citrate can be used to induce ovulation in women with PCOS. Finally, in some cases, surgery may be necessary to treat PCOS. Laparoscopic ovarian drilling is a surgical procedure that can help to reduce androgen levels and improve the symptoms of PCOS. The benefits of exercise for PCOS. Exercise is an essential part of treating PCOS, as it can help to regulate hormones, reduce inflammation, and manage weight. Regular physical activity can help to reduce the risk of developing health complications such as diabetes, heart disease, and high blood pressure. Additionally, exercise can help to reduce stress and improve overall well-being. When it comes to exercising with PCOS, the key is to find activities that you enjoy and to make them a part of your regular routine. Aim for at least 30 minutes of moderate intensity exercise a day, such as walking, running, or cycling. Strength training is also beneficial, as it helps to build muscle and improve insulin sensitivity. It's also important to get enough rest. Aim for 7 to 9 hours of sleep per night to ensure your body has time to rest and repair. Managing stress to reduce PCOS symptoms. Stress can have a significant impact on PCOS symptoms, so it's important to manage stress levels. Stress can interfere with hormone production and lead to an increase in androgen levels, which can worsen the symptoms of PCOS. There are several ways to reduce stress, such as meditation, yoga, and deep breathing. Additionally, engaging in activities that bring you joy, such as hobbies or spending time with friends, can help to reduce stress levels. Finally, it's important to get enough sleep. Aim for 7 to 9 hours of sleep per night to ensure your body has time to rest and repair. Understanding hormone replacement therapy for PCOS. Hormone replacement therapy, HRT, is a common treatment for PCOS. HRT can help to regulate hormones and reduce the symptoms of PCOS. The most common form of HRT is the combined oral contraceptive pill, which is a combination of estrogen and progesterone. The pill can help to reduce androgen levels, regulate the menstrual cycle, and improve fertility. Additionally, HRT can help to reduce the risk of developing health complications such as diabetes, heart disease, and high blood pressure. It's important to note that HRT is not right for everyone and should be discussed with a doctor before starting. Exploring the pros and cons of surgical options for PCOS. In some cases, surgery may be necessary to treat PCOS. Laparoscopic ovarian drilling is a surgical procedure that can help to reduce androgen levels and improve the symptoms of PCOS. The procedure involves making small incisions in the abdomen and using heat or laser to destroy the tissue in the ovaries that produces androgens. The procedure is typically done under general anesthesia and can cause side effects such as pain, bleeding, and infection. In rare cases, surgery may be necessary to remove cysts or tumors from the ovaries. This type of surgery can help to reduce the symptoms of PCOS and improve fertility. However, it is an invasive procedure and should only be done in extreme cases.